With teeth whitening, what we do here in the office is a process where we get impressions of your teeth. So we have models of your teeth, and we make trays that are custom fit to your teeth. And you actually put the bleaching material, which is a peroxide gel, you put that in the trays either during the day or at night, depending on the product we're using. And you do that over the course of 2.5 weeks. For most people, if they go through the whole kit for the whitening, most people get to probably where they're going to get on whitening. There are folks who have some significant coloration of teeth, tetracycline staining, a lot of darker color. And there are some folks who benefit from doing whitening for a longer period of time too. And we can add extra whitening to the process, extra bleaching solution. But that's the process we use in the office. Years ago, we did some in-office bleaching with a light and a high-powered bleaching solution. And it took a lot of time you sitting in the chair with some fairly caustic items in your mouth, and it just wasn't I was never happy with the result. We ended up making trays for patients and sent them home with them anyway. So it cost a lot more. I wasn't thrilled with the results, so we've quit doing that. I mean, there are offices that do 1 hour in-office bleaching, and some patients like that. I just don't think it gives us the result we want. And then the other option on bleaching are the over-the-counter products. And I usually don't discourage people from trying that if they'd like to. I just tell them, if you know some sensitivity, lay off of it. Avoid it if it's causing sensitivity. And typically the trays that we make, you're going to get the best change over the over-the-counter products that are available. And one thing with whitening too, it lightens the enamel, it lightens the teeth. It won't change the color of fillings, the color of crowns. So anyone who has fillings that show on the front teeth, they just need to be aware of, it's quite possible they may need changed after the whitening's done because they're going to be too dark.